Official power viewers, on behalf of the crew of Health in the Spotlight, I just want to wish you all a happy new year and looking forward to a much fruitful and a healthy year. Cervical cancer is the commonest gynecological cancer killing women in Ghana, yet nothing much is said about it. It's so preventable and easily treatable if detected early. In the month of January, which is known as the Cervical Cancer Awareness Month, Health in the Spotlight will bring to your screens insightful interviews with health workers and stories of some women living with cervical cancer. As the founder of an NGO that supports cervical cancer in Ghana, I'll give you an exclusive interview and tell you guys every detailed information about Cervical Israel NGO. I urge you all viewers to keep watching Health in the Spotlight, the only talk show on health that brings to your screen stories and informative discussions that will inspire you to take an informed decisions about your health and life. I'm Rina, and please stay tuned. I'll be right back. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suits your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad is the safest and healthiest organic pad every lady needs to use. Royal Atlantic Tuna Flakes. It's made in Ghana and the taste is pure hair, quality hair for confident look. A special thank you to Star Bites Airport branch. Guys, come meet, eat and drink. Welcome back, viewers. And the statistics of cervical cancer in Ghana are quite terrifying. Ghana has a population of 8.57 million women ages 15 years and older who are at risk of developing cervical cancer. The current estimates indicate that every year, 3,151 women are diagnosed with cervical cancer and 2,119 die from the disease. Cervical cancer ranks as the second most frequent cancer among women in Ghana between the ages of 15 and 44 years. Today on the show, I have with me Dr. Akosua Appiah. She's a medical practitioner from H.I.T.S Hospital, and she's going to educate us on cervical cancer. Welcome to Health in the Spotlight, Dr. Appiah.
Thank you, Rina, for having me.
It's a pleasure. So please, what's cervical cancer?
Okay. For us to first talk about what cervical cancer is, I think we have to know what the normal cervix is and where it's found. So the cervix it's like an opening to the uterus. It is centered between the uterus and then the vagina. So the uterus is what the layman knows as the womb, and it's like a gateway for which a child that is in the womb passes through.
Okay.
So in the course of labor, that is what dilates, and then the child later passes through to come out of the body.
Okay.
So cervical cancer, it's an abnormal growth of cells of this cervical region, which has the ability to spread to all parts of the body.
So we'll start from the cervix, but it's likely to spread
to all parts of the body, and it's abnormal growth of those cells within the cervix.
But so what causes cervical cancer?
Well, it's been known that it's been caused by a virus known as the human papilloma virus,
these viruses,
which is being acquired through sexual contact. That is the main cause of it.
So when you have unprotected sex,
yes,
it can't pass through the condom.
No. Not the research has not researched into it, but then they said condom is okay. Condom is one way for which we are able to prevent it from getting that infection.
Oh, okay, right. But with this cervical cancer, I mean, obviously it's women that have cervix, so women are at risk.
Yes, but then the human papilloma virus, we have different subtypes, which can also infect men as well. But then the subtypes, depending on the kind of subtype, causes different kinds of cancers. Okay, so we have oral cancer, we have penile cancer, and all other kinds. So it's just that we just have to protect ourselves.
Oh, okay. So the oral cancer is when you obviously practice the oral sex.
Yes.
Hey, Dr. Appiah, are we safe? Are we safe again in this world?
Yes, we are. If we take care of ourselves, we are safe.
I think it's important we take care of ourselves.
Yes.
So what are some of the other risk factors of cervical cancer then?
Okay. So as I said earlier, how you get infected with the virus. So through sex. Is a risk factor. So any woman that has reached, or any man that has reached his
sexually active,
is sexually active, at that period you are at risk of having it. The age, women between the ages of 30 up to 60. Those are the age ranges that we find these cancers. But then it doesn't mean that beyond you will not.
You will not get it.
It's just that the human papillomavirus infects us at early stages, and it takes about 10 years for this cancer to evolve. So let's say for a woman who has started having sex at the age of 20 is at risk of having the disease from 30 years, because like 10 years interval from 30 years upwards to the age 60 years. But it doesn't mean it cannot come after 60 years.
Which means that you are likely to be walking out there healthy as a woman.
As a young woman, you can be walking out there with the traces of the virus, and then the process of the cancer being evolved every day. So that is why we emphasize on screening at younger age, or vaccination at younger age. So aside the age, we also have the race. Most Africans, Black Americans, are the ones at risk of it.
Hey.
Smoking is another risk factor.
Smoking,
yes.
Is it a shisha or the weed, or all smoking be smoke?
All the smoking. All smoking be smoke.
Okay.
So smoking is not advisable. What smoking does is that it changes cell types, and then it puts you at the risk of having cervical cancer. If you have a first-degree relative who has already been diagnosed, it means that as a relative of such a person, first degree, that means you are the same level as a family member.
You're closely related.
Yes. You also have the risk of having the cervical cancer. Women who marry at very early ages. Women who are also promiscuous. And the other way is also true. Men who are also promiscuous. What men does is that if a man is promiscuous and then has a woman who is not, the man is likely to also infect the woman. And then when the woman is also promiscuous, that means that you go and take your disease and then maybe affect other people later. Yes. Women with multiple childbirth, there's always trauma to the cervix. I told you that is where mostly childbirth comes through. Sometimes during labor, when you are delivering, there's this trauma to the cervix and all, which causes changes around the cervix, and then can cause cervical cancer at later stages in life.
Women.
And then this part, oral contraceptive, is also a risk factor.
The family planning.
Yes, the family planning pill. That is taken every morning. It's also a risk factor. But it doesn't mean that anybody that takes the oral pill you are just at risk. But it's not certain that you are going to get cervical cancer.
Okay, all right. Dr. Appiah, I want to ask, please, the women that get raped, unfortunately, at this point, where do they stand?
Well, it's rather unfortunate, but then they also have to screen themselves. That is what I can say. They also, because it's not their, it wasn't their will for them to be raped, but then it means that with time, you've been exposed. Well, some can even not get the HPV virus, but then you still have to screen yourself for the disease as you live.
Okay, all right. So for the signs and symptoms of cervical cancer, what are some of the things that women will see, and then they'll probably think that it's cervical cancer?
Okay. So the thing is that cervical cancer is mostly asymptomatic. When we say it's asymptomatic, then it means that there are no specific symptoms that will make you see like malaria. When you're about to get malaria, there's fever and you run to the doctor, or there's headache or something and you run to the doctor.
Okay.
It's asymptomatic. So most women that are picked up whenever they go on, I bring myself, let's screen me. Okay. But then if there are symptoms, that is when they come very late. That is when you know how the Ghanaian life is. Until I see something before I go and see a doctor.
Check.
Yes. And mostly it's about postcoital bleeding. After sex,
they
they notice
bleeding.
that there is bleeding. And then in older women who have stopped having sex, it's like when they've gotten to their menopause, they know they don't bleed anymore, and then they see some form of blood, then they rush to the hospital. And it's so sad that at that point, that most of the time the disease have gone so far that there is little you can do for them.
Oh.
So mostly that is one symptom, the bleeding. Another symptom is noticing brownish discharge, and then also a smell that comes with the discharge.
How is the smell like?
It has a peculiar one that you know it's a bad odor.
Okay.
Yes, it's a bad odor. Sometimes practitioners even know that this woman coming into my consulting room might have cervical cancer just because
of the smell.
Yes,
hey,
it happens. So the other part, as I said, it has the ability to spread to all parts of the body. So depending on where it has spread to, some come with liver conditions, some come with kidney conditions, some have difficulty breathing. You do a chest X-ray and other labs, and then you realize that the disease has gone that far.
So it starts like cervical cancer of the cervix.
Yes, it starts at the
cervix.
Localized. When we are talking about the classification, you know, it starts as a localized disease, then spread to parts of the body.
To the kidney.
So from, you know, the kidney is mostly close to the reproductive system. So that is, it's closer to it. So that is where it spreads to before it goes even as high as the lungs.
So can you say that it can lead to kidney failure?
Yeah. It's some of it causes kidney failure in some. So even some come because of the kidney failure. Then later on, they realize that it is cervical cancer that has caused that.
Hey.
Yes. So the need for screening
is very important.
My emphasis is always on the screening.
Women, I beg you, please. You're hearing what I'm scared as I'm sitting here. Don't wait to be victimized. That's all I'm going to say. Please get screened. Please get screened. Dr. Appiah, how do we prevent cervical cancer?
Okay. So if you know what causes it, then you can know how to prevent it.
Yes.
So as I spoke earlier, but then let's talk about primary prevention and then secondary prevention. So primary prevention is when you have a child who has not started having sex, what you can do, what you can tell them so that they don't end up having the infection. So one of them is vaccination.
Okay.
And then the other one too is lifestyle modification. So in terms of lifestyle modification, we advise children not to engage into sexual activities when they are not ready. And even if they are ready, they have to use barriers like a condom that we spoke about earlier. Then also, if they have to stick to one partner and be faithful, that will be very, very good.
Very good.
Yes. And then the vaccination, I think we'll talk about that later. The children as young as 9 years can have the vaccination. So when they are vaccinated on time, they tend to get immunity on time. And whenever they come into contact with this human papilloma virus, yes, their body can fight it.
Okay, all right.
So the secondary prevention is for those who have already started having sex. Yes, what they can do is that they should have regular checks.
Okay.
So a pap smear, maybe you decide that every year you want to take a pap smear, or every 3 years you want to take a pap smear, and also be faithful with one partner. If you are.
Dr. Appiah, please hold on with the faithfulness. I'm really enjoying myself on the show, but I have to take a quick break. There's more to come, viewers, so please stay tuned and I'll be right back. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suits your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad is the safest and healthiest organic pad every lady needs to use. Royal Atlantic Tuna Flakes, it's made in Ghana and the taste is pure hair, quality hair for confident look. A special thank you to Star Bites Airport branch. Guys, come meet, eat and drink. Welcome back, viewers, and we are still learning more about cervical cancer. Now, Dr. Appiah, before we took the break, we're talking about the faithfulness.
Yes.
Please, some people think that the fact that I have one man and me too, I'm just sticking to one man, it's faithfulness. But I know that the faithfulness is not just one man to one woman, because you might just be staying there doing one man to one woman. But what about your other partner? So can you please delve more about the faithfulness?
Exactly. So if you have one partner being faithful and the other not being faithful, it means that the other one has the potential of going to bring the virus to the one who is being faithful. So it means that it has to be both ways. Both of us has to be faithful. And even if your lifestyle was quite different before you partnered with this one.
Before you met the Lord. I'm kidding.
Then it means that you are still at risk. So it's not about being faithful at that point
that will
of your
save
life.
you.
Yeah, it has to be throughout your life. Yes.
Which means that it's actually has a lifestyle thing attached to the whole thing.
Exactly.
Oh, okay.
Exactly. Most of it is a lifestyle kind of ways for you to get the disease.
So apart from the being faithful, what are some of the lifestyle habits that can make one person?
So I spoke about smoking. It's also a lifestyle.
What about drinking?
No, drinking has not. Okay, it hasn't been found to cause cervical cancer. Alcohol. It's mostly,
it doesn't predispose you to.
It's mostly smoking. Then, you have to eat well. You have to take care of yourself. Even lifestyle has to do with how you take care of your health, which is going for the screening as well. It has to be a lifestyle that you have to adopt. Yeah.
Talking about the screening, how many types of screening do we have?
So we have about 3 types.
Okay.
So we have the pap smear, which everybody, it's so common out there that everybody knows. And then another one where we use what we call acetic acid to visualize the cervix and then know which part has been affected or not. Then we have what we call colposcopy, where we use a magnifying glass to look through the cervix to see if there are parts that are changes.
Okay. Yeah. Okay. But is it cheap and is it affordable to every woman?
Well, for an average woman, you can afford. But even if you cannot afford, you can try and save up and do it, because the screening is done every 3 years. If only you go and then your results are negative, we screen you every 3 years. So for an average of...
Please define average woman. Because my viewers are like, this doctor, what does she mean by average woman?
So let's say an average woman, I would say someone who has something going, who can save about 50 pesos a day.
Okay.
If you can save like 50 pesos a
day.
Yes.
Oh, then we are all average women.
Yes, like for the whole year, you can at least...
You can afford the
screening.
screening. Okay, yes. All right. And where in Ghana can the screening be done?
Well, Kolebu is one place, Adabraka Polyclinic. Then there are other private facilities that does so as well.
For screening.
And then in times of, especially this January month that is for cervical cancer awareness month, a lot of places would have screening that is voluntary and all of that will come out. So you just have to keep your ears out and do the screening. Oh, okay. If you say you will do it every January, at every January you will get a convenient place to do it. And even some do it at a discounted price.
For the month of January. That's nice.
So you can decide that every January is my month of screening, which is a good idea.
Oh, okay. So we can screen every year?
Yes, you can do a screening every year.
You can do the screening every year.
But then if you do, mostly, the ideal thing is every 3 years. That's the ideal thing. If your last results was negative, you can wait till the next 3 years to do another screening. But then if your last result had a problem, then I think every year, or as much as the doctor will recommend for you, you do the screening.
Okay. Yeah. But Dr. Appiah, I'm very concerned about the statistics that I read. Over 3,000 women being diagnosed, and out of that, over 2,000 women. That's quite alarming. Yeah. What do you think is causing this high rates in cervical cancer amongst women in Ghana?
Okay. I think the screening has not been made possible for everyone. And then, as I told you, the Ghanaian thing is, I see symptoms before I move to the hospital. Unlike the Western world, there are times when you have to go for your normal screening with a gynecologist, whether you are sick or not sick. So the Western world, that's what they've adopted, and they've been able to reduce the occurrence of this cervical cancer. So I think Ghana has to adopt such a method in order to reduce the number of people who get affected. Yeah, I think that is it. That's the reason why our numbers are quite high in Ghana.
I think it's true. And also maybe because people don't, could it also be that because people don't even know what cervical cancer is at all?
Yeah, well, now in the past, it used to be like people don't even know what it is, and people don't believe.
Yeah.
You know, in our setting, everything is either spiritual. We have to go to the pastor first to be prayed for before we move to the hospital. Yes. But then now, I think now it's, the awareness is coming out there, but then we need to do better.
Okay.
Yes. So what about the people in the rural areas who don't have televisions and all?
Yes.
I think we need to send it to them for them to also get to know, and even offer free screening at the level of the district or the rural areas. Yeah. We have to have commitments by the government to go there and also help them as well.
Yeah. With right now, I'm thinking towards the sex education in Ghana. Sex education in Ghana is a different level. I mean, we all know it's poor. Do you get this? But here's the case. You mentioned with our primary prevention, it's about these young girls and these young guys.
Yes.
And they are sexually active. For that one, we can say for a fact. Please, how do you think we can help these young ones so that they will not fall victims to cervical cancer?
So one of them is, I think we have to make vaccination very affordable for everybody. It should be incorporated in most of our normal vaccinations that we do for babies when we have them. So they can have it for free, and then the education too has to be intensified.
Yeah.
And then as parents, you and I have to take it upon ourselves to take care of our kids and let them know the right things to do. I think basically with that, we can achieve good results.
I like the parents part because the kids, if you don't tell them, they'll go somewhere else and try and find answers.
Yes, so we have to be very strict, and then also try and then bring our children very close to us so that we can educate them very well.
Very well. Yeah. And the vaccination, is it can we give it to a baby, or at what age can we start vaccinating them?
Okay, so the good age for vaccination is between the ages of 9 to 13 years.
Okay.
That is the good time for vaccination. At that point, boys and then girls are not so sexually active.
We assume.
Because now the world is changing. We assume that they are not sexually active.
Yeah.
And at that point too, they respond better. The vaccines that are on the market, they respond very better to it at that age.
Okay.
But then it doesn't mean that at later ages too, we cannot vaccinate
them.
So up to the age of 21, we can have the vaccination if only we are not sexually active. But then if someone is sexually active before the age of 21, then it means that you have to do a pap smear. And when it's negative, then you go ahead and then vaccinate.
All right. Yes. Sure.
But then older women who have not engaged in sexual activities will still have to go through the process of having a pap smear before we are given a vaccination. Yes. But the ideal age is 9 to 13.
All right. Okay. Dr. Appiah, recently I read somewhere that most of the parts that we have on the market are plastic made, and most of them contain all these chemicals like dioxin and all that actually can lead to cervical cancer. Please, how true is this?
Okay. The findings are quite true. Yes, there are some researches that are being done in the Western region. Mostly in the past, what they used to produce these tampons and pads were mostly made of a chemical known as dioxin. Okay. It's a product of bleaching the parts that comes out, and then when a woman uses, the person gets exposed to this dioxin. And this dioxin, not only does it cause cervical cancer, it also causes other cancers as well. But then when it was noticed, some countries are trying as much as possible to take it off the market. But then in Ghana, well, some efforts are still being made. Yes, to try and then get such things off the market.
Yeah.
Yes.
I think H.I.T.S guys, I think H.I.T.S is doing organic parts.
Yes.
When we say organic parts, like Dr. Appiah mentioned, in as much as you can see plastic, it's all biodegradable plastics. And it's full of organic materials. You can see that it has all the black thing that you see is just bamboo charcoal that is going to soak the blood so that you don't even smell.
exposed
And
to-
it's healthy.
okay.
I don't know why, out of no fault of you. I mean, menstruation is no fault of ours. We are women, we menstruate, it's part of our life.
Okay.
But the fact that I'm going to use a wrong pad will cause cervical cancer. We need to be aware of that as women.
Women have to be very careful of what they use, and then they have to try. And even though it's a bit expensive, but then I think we have to try.
Yeah.
And then also, I think government has to find a way to stop this fake things coming into our markets.
They
and
have
try
to.
and promote,
because most people don't know.
Yes.
Most people don't know what they are putting there. They think, oh, it's just 5 cedis, so
they
I'm
go
just
and
putting
then
it there.
the cheaper ones are the ones that they can afford. So, but then we have to also try and then know that the things that are cheap sometimes can harm us.
Anyway, thanks to H.I.T.S. This is very cheap. It's like 7 cedis.
So I recommend H.I.T.S to every woman that is watching us.
Yeah.
This is very good.
It's a very good initiative, and it's made in Ghana.
That's a good product.
It's a very good product. It's made in Ghana.
So not only will it prevent you from having cervical cancer, there are other cancers as well that if you get into contact with this dioxin can also affect.
It will affect you.
I would advise that we get proper parts at the end of every month.
Every month.
Yes.
Yeah. Dr. Appiah, treatment. I know that I mean, after listening to all that you've said, that it can even lead to kidney failure. I can't imagine what the treatments will entail. But please tell us the treatment for cervical, if there's even treatment at all for cervical cancer.
Okay. First of all, the treatment will depend on what we call the stages.
Okay.
So when someone comes and then has any complaints, or after the whole cancer thing has been picked up by a pap smear, what we do is that we stage the disease.
Okay.
Okay. So we have stage 1, stage 2, stage 3, and stage 4. So every stage depends on how far the cells have, because I told you that it has the ability to spread to all parts of the body.
Yes.
Yes. So stage 1 disease is mostly a disease that is confined within the cervix.
Okay.
And that is it has a very good prognosis. When we talk about prognosis, it has a good result.
Okay.
Yeah. Then stage 2, it has just spread beyond the cervix into the vagina.
Okay, so it comes down to the vagina.
The vagina, then it also spreads upwards, but then it hasn't gotten to the walls of your pelvis.
All right.
Okay. Then stage 3 is it has gone beyond the vagina and to the pelvic region. So that is where this kidney failure and things come. So if somebody is coming with a kidney failure, then you know that the person is at stage 3, and at that point it's gone too far. And then stage 4 is when it goes to all parts of the body, the lungs, the liver, and all parts of the body. So when you come at an early stage, which is confided within the cervix, then we can take out the cervix. We have a type of surgery that we do. We take out the whole cervix, because if it's within the cervix and the cervix is out, then there is a possibility that your life. Yes. Yeah. So we have about 95% of people surviving after 5 years when the whole cervix, the whole womb.
Let's take your womb.
Yes, the womb is taken out, especially for somebody who has already delivered. Why would you need a womb
exactly.
Yes.
But right now, for those who haven't delivered,
so it means that you have to
get screened.
You have to, and also deliver on time. That is if it's God's will. You deliver on time.
I know.
And also get screened on time. And then, because sometimes when the lesion is a little bit below 4 centimeters, we are able to 4 millimeters. Sorry, we are able to cut that portion off. Then you achieve your childbirth. Then we go ahead and take the whole uterus and the cervix out. But then for stage 2 and all that, sometimes there's a combination of surgery and then what we call radiotherapy.
Okay.
So what we do is that you have the surgery and then we use the radiotherapy to kill the cells that we couldn't take out. Then there's also what we call chemotherapy, where chemicals are infused into your system to kill the cells that are cancerous.
Oh.
That is mostly what is done for latter part of stage 2 and stage 3.
Okay.
But for stage 4, mostly the disease have gone to so many parts. So what you do is that you try and provide comfort for the one who has the disease till the time they are called to their maker. Yes. And that is what is happening in our society, such that most people are losing their lives. Yes. So it's very necessary that we get screened, we find it on time, and when we are able to save people's life.
Yeah.
Yes.
That's so sad, because I can imagine something that starting from the cervix and ending up, it's like it end up eating every part of you.
Body. Yes. So that's why we emphasize on the screening all the time, and that yes, it's treatable. If only it is found early. You'll be able to have the surgery or whatever modalities that is necessary for you.
And that will then be affordable.
And at the end of the day, you live your normal life like a normal person. That it never happened. So cervical cancer is real. It's good when it's being detected on time, and you can have a normal life even after being diagnosed of cervical cancer. Yes.
Wow. Is there any advice you will give to our viewers when it comes to cervical cancer?
Okay. So what I would like to say to everybody is that cervical cancer is very true. It is there. So we have to try as much as possible to get screened and also to get cured at the point that is very necessary for us to live our normal lives. Because when it gets infected to our mothers or whoever it's getting infected to, you should know that that person might be a breadwinner to others. So when you die, then the other people they are sad, or their lives are jeopardized in one way or the other. So aside we ourselves, if the government is not making any provision for us, I think we should take it upon ourselves to try and then take care of ourselves. But then we also beg the government that they should make it easier for everybody, every woman to have the screening as well as the vaccination, every child to have the vaccination. And don't forget, it's not only about the girl child, the boy child is also included. So we should give them education as to how they'll live their lives. Their lifestyles should be on point so that they can prevent and protect everybody around them. Yes, that's basically what I would tell. And then we also have to take care of what we have to be careful of what we are putting into our bodies, especially this part that we use on the market. It's not about it being cheap, so I buy it. You have to know what you are taking into your body, what is coming into contact with your body. So let's stay safe.
Thank you so much.
Thank you so
Rina.
Much. You're welcome.
I've learned a lot from this interview. Do you get it?
You're welcome.
I really appreciate you coming. Viewers, it's been interactive, educative, and very captivating today. I know that you've learned something new. Women, we are in the month of January. Please give yourself a treat and get screened. Know your cervical cancer status before you start seeing signs and symptoms. Dr. Appiah said, it might be that you got exposed some years back and you are walking normal, healthy, so you don't know. It will take screening for them to detect if you have any exposure to the virus. So please get screened. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suits your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad is the safest and healthiest organic pad every lady needs to use. Royal Atlantic Tuna Flakes, it's made in Ghana and the taste is purer hair, quality hair for confident look. A special thank you to Star Bites Airport branch. Guys, come meet, eat and drink. Guys, it's never a down moment on Health in the Spotlight. I'm looking fabulous today, and thanks to Pura Hair for my beautiful hair, my lovely makeup from Hair Luxury, and then also my necklace from Najif Crafts. I have to sign off, guys. Thank you so much for watching Health in the Spotlight. If you know you haven't subscribed, please subscribe, like, and share. I'm Rina, and thanks for watching.